Very pleased to bring on cardiologist Dr. Fahmi Farah. Dr. Farah, thank you so much for joining us today. Wanted to get more insight from you. First of all, what was your thought when you saw the player Hamlin go down and then the reaction afterwards? What are you thinking?
A number of thoughts actually ran through my mind that could have been the cause of this cardiac arrest. He's very young, of course, only 24 years old. Typically, when we see a 24-year-old collapse like this on the football team, it's pretty classic of a condition called hypertrophic cardiomyopathy. It's usually something that the person is born with. The condition entails the muscle of the heart is usually enlarged. It's very thickened. And that condition is usually genetic. They're born with it and they don't realize it. They live with it because they're young and they're fine. And they typically collapse and have a cardiac arrest during a strenuous activity like sports. So that definitely could be one of the reasons why this happened. Although he has been playing for quite some time. This is not the first time he's had this kind of an activity, but it can they can escape it for some time, and then they'll have arrhythmia. For people who have these types of conditions, arrhythmia means heart kind of goes erratically, like it gets out of sync and the heart just beats in a very erratic rhythm and very fast. Typically that condition is called ventricular tachycardia, and that's what leads to the collapse and cardiac arrest. It could, however, be many other reasons as well. Earlier during the pandemic, I know that we have seen several young athletes collapse, and we've even had cardiac arrest leading to death in several athletes as a result of COVID-related issues with the heart. A lot of athletes we've seen before, they were asymptomatic from COVID, but they did have, it impacted the heart and they went into ventricular tachycardia, which is the arrhythmia that can happen as a result of COVID as well. COVID can cause something called myocarditis, which is inflammation of the heart muscle that can lead to certain arrhythmia that I'm talking about and can lead to cardiac arrest. I do know that he was hit in the chest area, and that concerns me that it may have been something mechanical with the heart that could have caused a cardiac arrest. Mechanical meaning the heart sits in a sac. It's called it's called a pericardium. It sits inside a sac. And whenever we get a blow to the chest, for example, in a car accident, when the airbag kind of blows up and it hits our chest, any kind of big blow to our chest can cause blood to build up around the heart and within that sac. And the blood doesn't have anywhere else to go. So it starts to squeeze the heart in such a manner that the heart stops is able to not function properly. So it's not able to squeeze and beat properly. And that can lead to arrhythmia like ventricular tachycardia and cardiac arrest as well. Of course, there's heart attack, which could have happened. We do see heart attack in young folks from time to time. So it's a number of things that could have caused this.
Doctor, I want to go to what happens next. We're hearing reports that he has his pulse back to normal, which seems to be a positive, I would assume, but he also is being helped by a breathing tube, essentially to keep his lungs moving. When you hear that information, what goes through your mind and what can we expect in the upcoming hours and days?
Yes. So basically, when he had a cardiac arrest, it's a complete collapse of your entire cardiovascular system. So it's not just that your heart stopped beating, you're not able to breathe, just like you said. And so they're usually ventilated, meaning a breathing tube is put in their mouth that goes into the trachea and a machine breathes for them. That's vital because that's what's keeping him alive right now, so to speak. And that means he is in critical condition still. That's what that means. I will say it does worry me because out of hospital cardiac arrest, the survival rate for those are actually not very high. The numbers are against us. However, he's young, and the fact that he got very prompt care, the CPR, which is, CPR was started very early. And my understanding is that it went on for 10 minutes, the CPR, which is in the big scheme of things, not that long. And the fact that he got CPR as soon as it happened, those are positive things. I'm optimistic.
And doctor, that's my last question for you. I wanted to ask about that. 10 minutes for CPR, at least maybe to the layperson, felt like it was a lengthy amount of time, but you're saying that that is something that can happen from time to time, depending on the situation.
It can. 10 minutes is not short time, but it's not like 30 minutes or an hour. If somebody has to go through CPR for more than 30 minutes, their odds are less. Now, 10 minutes, again, it's not a short time. One of the other things we worry about when a cardiac arrest happens, it's not just the fact that he has a pulse, which means he's alive right now, although he's in critical condition. It's the aftermath, the damage. A lot of times people can sustain neurological damage from the lack of oxygen during that time. So, again, the fact that he received CPR so early on after the collapse minimizes that risk of having neurological deficits when he is more stable and he's off the breathing tube. We'll have to wait and see what it entails in terms of complications from this event.
Yeah. Well, Dr. Farah, thank you. This information helps us understand what happened and what is happening going forward. So we really appreciate your time here on Local News Live.
Thank you very much. It was my pleasure to be here.
Cardiologist Dr. Fahmi Farah with that wonderful information that really gives us a better idea of what we're looking at with Damar Hamlin. And now we understand what may happen over the next hours and couple of days. Okay, we're going to take a 2-minute break. When we come back, we're talking with a representative from a nonprofit that advocates for CPR training. You heard Dr. Farah say it. They were using CPR for 10 minutes and it may have saved the life of Hamlin. Why is it so valuable? We'll talk about that in a few moments on Local News Live.